that we'll be having over here. So in this class, as you can see there, today we'll be discussing about the types of letter, right? So yesterday we just have discussed few introduction, but today we are going to discuss different types with reference to the introduction. Right? So if you can see, first of all, a type of referral letter, there will be a letter that is a type of referral letter with a diagnosis when we have a diagnosis being given in the referral letter, right? We have a type of referral letter with diagnosis when we do have a diagnosis being given in this letter, right? So it's a simple letter. When we do have a diagnosis or being given, we can simply write it down directly in the introduction about your diagnosis, such as, thank you for seeing Mr. Mark, a 20-year-old accountant whose signs, symptom, and investigation are suggestive of diabetes mellitus. Then we can see I'm writing to refer Mr. Mark, whose symptom are suggestive of Cushing syndrome. So in these two cases, we can see that we can write it down, diagnosis, if the diagnosis is being given as it is directly, okay, over here. If we have to see, we have to write it down, the diagnosis as it is, if it's being given into the your case notes, right? We're not supposed to change anything over here. Then we can see we have a letter of referral without a diagnosis, right? Okay. We have a letter of referral without a diagnosis. So we can see there, we have to see if there is investigation, there are investigation, we have symptoms, we have history, okay? We can just write it down, those things over here, right? So as a matter of fact, we have a type of referral letter without a diagnosis. When we do have, we can say just the symptoms or the investigation being given over here, we can simply write it down in this regard with reference to the presenting symptoms or the complaints. You can write it down directly. Being a GP, you are not supposed to, we can say, write down anything over here, being a GP, right? So we can just write down the thing that has been written as it is. We have to see, we have to write it down as it is, okay? Okay, so you can see that we have, let's say, thank you for seeing Mr. Alex, who presented with 3-week history of lethargy, decreased vision, and so on. Okay, so we have this letter without diagnosis. We also have a letter with differential diagnosis, right? We have a letter of differential diagnosis, right? So, okay. So we can see there, we have a letter of referral with diagnosis, without diagnosis, right? And we have a letter with differential when we do have two different diseases being given. Okay. We do have two diseases being given. Let's say we have to write it down, that thing as it is in the introduction, or we can simply write it down, the differentials. We can simply write it down, the differential diagnosis clearly in the introduction, right? So we can see that if we have a differential diagnosis, in this regard, you have to put it on, let's say, we have to write down these DDs in the introduction as it is. As you can see, I'm writing to refer Mr. Alex, let's say, right? I'm writing to refer Mr. Alex, whose signs symptoms are suggestive of an early bowel obstruction. Just give me a moment. Since we have different diagnosis, I'm writing to refer Mr. Alex, let's say, whose signs and symptoms are suggestive of an early bowel obstruction secondary to diverticulitis or carcinoma for a definitive diagnosis and further management, right? We can write it down, these DDs in this way, right? I'm writing to refer Mr. Alex, let's say, whose sign and symptoms are suggestive of an early bowel obstruction, secondary to diverticulitis or carcinoma, for a definitive diagnosis and further management, right? And you can see we have to write it down. Thank you for seeing Mr. Alex, let's say, whose features are suggestive of an acute pulmonary edema or acute myocardial infarction if we have two differential diagnoses over here. Then we have another referral. Let's say example, I'm writing to refer Mr. James, who has a differential diagnosis of bipolar disorder, depression, or schizophrenia for a definitive diagnosis and further management. If we have a differential diagnosis, so we can write it down directly DDs in front of you. Similarly, if we don't want to write down the diagnosis, we can simply write it down. You can say, the symptoms as I'm writing regarding Mr. James, who presented today with hereditary hallucination, linear thoughts, and he feels full up, right? I just have a typo mistake over here regarding over here. Anyhow, so he just feels full up. So I would appreciate if you could further investigate for a definitive diagnosis. So we can write it down over here. Similarly, you can see that if we are writing a letter of discharge, if we have 4 to 5 diagnoses or more, maybe more than, so the formula remain the same, either to write it down directly the symptoms, either to write it down the symptoms in the letter, right? Or else you can see that we have to mention about the DDs directly. Maybe I'm writing to refer, okay, I'm writing to refer this patient, let's say, who presented to my clinic today, okay, you can say with, let's say, with X, Y, or Z, right? Right? So we can simply write it down. These DDs, I'm writing to refer Mr. XYZ, let's say, who has symptoms of, let's say, blah and blah. Or we can simply write down in this way, I'm writing this letter of discharge. Sorry, I'm writing this letter to refer Mr. XYZ, who according to my differential diagnosis has X, Y, Z, blah, 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 or blah for further management. So either to write it down, the DDs in the introduction, or else to write it down, you can say, else to write it down, the symptom in the introduction, right? Symptom in the introduction to be written, okay? So we can see that we can just write it down the differential diagnosis, maybe in simple, just mention all the DDs, or similarly, we can mention not all the DDs so the symptom can be written, right? So if we are writing a letter of discharge, in a letter of discharge, you can see there, we have to see, that we need to write a letter of discharge. First of all, if the letter of discharge in case of medicine, it's a simple concept that specialist is writing to the GP in simple concept. Specialist is writing to a GP. In this case, the social plus past medical history is not relevant, right? The social plus past medical history is not relevant. So we are not supposed to write it down, the social plus past medical history, in case if we are writing this letter to the specialist, by the specialist to the general practitioner. So normally we have a ward stay or the admission details, right? In a letter of discharge, we have the rehabilitation or the nursing management. We have the discharge plan, right? So basically what you can do is, it is a letter of discharge, but we can see that even as per your question, Dr. Suhail, they just write a letter of referral, or regarding Mr. XYZ, right, to Dr. Blah and blah for further management. They might not use the word discharge in some time, but you can see normally when we read the case note, you would have an idea that it's a letter of discharge. You have treated the patient and it's a kind of referral back. So we are referring this patient back to the primary care physician or to update him or her about his condition, right? Okay. So you can see there a letter of discharge to be written, right? Okay. Letter of discharge to be written, okay, or not. So we can simply write it down in this way. I'm writing to refer Mr. XYZ, who has been discharged today or who has undergone a successful right total knee replacement surgery and is being discharged today, right? So we can simply write it down in this way, right? We can simply write it down in this way, okay? So is it clear to you? Any question that you want to ask? Okay. So basically, if you can see there, you can see that we have this is the letter of discharge. Normally, in concept, the letter of discharge, the ward stay should be summarized, right? The rehabilitation also need to be summarized, and the discharge plan should be expanded, right? Discharge plan should be expanded. Yeah, this nursing management has to be mentioned. Nursing management have to be mentioned. Okay, nursing management has to be mentioned over here. Is it clear to you? Nursing management has been mentioned in the group, right? Fine. Okay. So afterward, we can see there, we need to write it down. Let's say different other letter, which include your letter of, you can say request to the occupational therapist, letter to a physiotherapist, letter to the social worker, letter for the eligibility of pension care, letter for home placement, and letter for a genetic review, right? So we can simply write it down, this letter over here, right? Letter of referral, letter of discharge as well over here, right? So we can see that if we are writing this letter to the occupational therapist, first of all, we need to know about the, you can say, about the job description of occupational therapist, what he know or she know about that, right? What he know or she know about that. So you have to know about the job description of occupational therapist, right? Anyhow, so as you can see there, we have to see if we are writing this letter to a physiotherapist, according to his requirement, you have to modify your things. If you are writing this letter to a physiotherapist, if you are writing this letter to a social worker, we have to see that why we are writing this letter. So to make it more clear, I can show you the slide. You can see that we can have such letter. If we are writing this letter to the nursing coordinator, all right, and he has to arrange a nurse for patient, assistant and her baby's assistance. We can also have, let's say, to a social worker. Again, it's a kind of unconventional letter of discharge. Although you can see that the patient had this surgery, like cabbage surgery. He is a refugee, taxi driver, married with 7 children, housewife, discharge plan with cardiologist. That might not be that much important. But you can see in the last line is being written to ensure a smooth transition back to normal life. To ensure a smooth transition back to a normal life. So we can simply write it down. I'm writing to request your social services for Mr. XYZ, right? Who now to help him resume his normal life since he has been discharged after a successful cabbage. Normally, the people do this thing, they write it down. I'm writing to request your social services for Mr. Nasir, let's say, or sorry, I'm writing to regarding Mr. Nasir, who has undergone a successful cabbage. Therefore, he need your expertise. Therefore, he needs social services. So it would not be appropriate to mention a successful cabbage first for a social worker. Basically, it would be better actually if you can write it down about the main point that would be relevant for a social worker over here. right? I'm writing to request your social services for Mr. Nasir in order to help him resume his normal life. The main point has been clearly addressed in the first line. So we might not write down this letter the way we used to write it down, the normal letter, right? Okay. Is it clear to you? So basically, if you can see that we have this letter over here. So, okay, we can move on toward the next task. We can see there. We are writing this letter of transfer to the hospice care. Again, it's a letter that we are writing to the hospice care. Hospice care means where the patient will stay during his last days of life. So normally it's a terminally ill patient. Normally it's a terminally ill patient. And for this terminally ill patient, we are requesting a place in the hospice care. So when we read these case notes, there is a patient who has cancer with widespread partial bowel resuscitation and colostomy performed. 6-week radiation therapy being done. Prognosis not expected to survive more than 3 to 4 months. Generally, he's pain free, very weak, disoriented, rejecting solid but able to tolerate fluids. Request apple juice and so on. So these points are more important for the hospice care. So we can see, let's say, when we read the case notes, these are the chunk of the case notes. Using information in the case notes, write a letter to the director of nursing. Let's say Glenn Heaven Palliative Care, whatever, introducing this patient, using this relevant case notes, give her background medical history and treatment required. So I can simply write down, I'm writing on the advice of social worker regarding Miss XYZ, a terminally ill patient who has been under our care for treatment of cancer. She will require place in hospice care. Or we can else write it down in this way. Let's say, basically, yes, sir. Recently, in the last exam, we had this letter to write a letter to the care manager. Basically, that was the letter in the last exam. Normally, we don't, and we won't include such letter in our practices, but we have seen such letters that we had in few exam. Now, ideally speaking, we have simple referral, we have discharge letter, we have transfer letter, but still we have to see and understand such letters so that God forbid, if you have something unforeseen, you can say, or practice letter you can see in your writing task. So at least you have an idea, okay, I've been through this lecture. Although we can see that when we will be practicing writing, less likely we have such letter in our practice. But I'm just gonna include this thing in the course to, like with reference to update our course. And we have seen last letter of OET medicine. It was a letter to a care manager who has to consult the patient so that he can start his job as he was having anxiety. So a kind of unconventional letter. So that's why we are discussing this letter. So write a letter to the director of nursing or maybe to the director of hospice care. If the doctor, there might be little bit modification, maybe you can expect, but you have to understand to see such type of request letter. If that letter can, if you can see this letter, it will not be a challenging thing for you, right? Anyhow, so we have a letter to hospice care. We have to understand the concept. So if we have unconventional letter, same thing we have to understand and you can do it. We can see then we have a request for a dietary advice. When we have a letter of request, we are writing for a dietary advice. So we can see I'm writing this letter to request. You can read this line. There's a patient who have this graft, for example, is recovering normally on this diet, right? Wounds healing, routine visit, discharge plan, returning home to this appointment made for follow-up visit to local doctor, local physician therapist to continue rehabilitation exercise program. Then we can write it down. I'm writing with regard to Mr. XYZ, a 53-year-old man who has requested advice on low-fat dietary guidelines and healthy recipe. After his discharge, since he has undergone a successful artery bypass graft. So we can simply write down, Mr. Riley has requested advice on low-fat dietary guideline and healthy simple recipe. Write a letter to the community information section of the Heart Foundation on the patient's behalf. Use the relevant case notes to explain Mr. Rayleigh's situation and the information he needs. Include medical history and information should be sent to his home address. So we can simply write it down this way. I'm writing with regard to Mr. XYZ, a 53-year-old man who had requested advice on low-fat dietary guideline and healthy simple recipe after his discharge since he had undergone a successful artery bypass graft, right? So we can write it down in this way. Is it clear to you? So it's a letter to be written for a dietary advice, or maybe simply we can write this letter to a dietitian. So to make it more simple, we need a dietary advice from a dietitian, right? Then write a letter of request to the age care assessment. For this age care assessment, we can see there, we have to write it down, for the age care assessment. Age care assessment is being done for the elderly patient mostly, if they have to transfer from hospital to home or maybe from to the nursing home. For that reason, we have to conduct the age care assessment, though it's very common in the nursing. But maybe this request has to be initiated by the GP, right? This request has to be initiated by the GP. So we can write it down. I'm writing using information in the case note, write letter to the director age care assessment team, let's say. So we can simply write down, I'm writing to request age care assistance for Mr. X, an 83-year-old man who is recovering from malignant melanoma in his left shoulder. So in this case, even malignant melanoma things are not important, but the thing that would be important, that is basically, for example, cooking, for example, shopping, for example, household things, right? The dependents, the family member, these things will be more important, and the assistance that they would require back at home. Similarly, we do have also a letter that is called as letter of request, maybe in case when we have to make a request for the pension care. So basically, in this case, we need to see that you should write it down, a letter to the pension care, right? Okay, so we can see that, uh, you know, like we can see that we have to write it down in this way, basically to make sure to highlight the point, let's say, to make sure and to highlight the point, right? So as a matter of fact, we can simply write down, I'm writing to request a home visit by Department of Veteran Affairs. I've just written a short form, but you have to write in full form, right? Okay. You can see there, we have to see that we have to write it down. I'm writing to request a home visit by Department of Veteran Affairs staff, let's say, Department of Veteran Affairs staff, to Mr. XYZ and his wife to assess their eligibility for the Department of Veteran Affairs pension and any other assistance that they could provide. We can also write it down in this way. I'm writing to request, let's say, a home visit, or we can simply write down, I'm writing to request regarding Mr. and Mrs. XYZ who need to be evaluated for their eligibility of the pension and any other assistance which could be provided to them by the Department of Veteran Affairs. So as long as your main point is concerned, it has been, we can say, it has been discussed, right? Anyhow, so we can see that it's not a common, but in the letter of request, we can have this scenario as well. We are just discussing this scenario for once so that you can understand if you have something out of the box, so you will be able to handle the situation. As we can see that from this introduction that has been written, after reading this line, we can see that it's simply we have to mention that the main concern should be addressed over here. I'm writing to request a home visit by Department of Veteran staff, right, and his wife to assess. So basically, we are trying to highlight that this thing should be addressed quite clearly over here. Okay, so you can see this is just an example for you that has been discussed. In this case, write a transfer letter. Normally, in a letter of transfer, we have a transport involved, Transport means from high to low and from low to high setting, sorry, which means that if we are writing a letter, let's say, for example, from the emergency department, from the periphery to the mainstream, right? From the periphery to the mainstream. We also have a letter from, let's say, ward to the emergency department. That is also a departmental transfer. We also have a same specialty transfer, right? Let's say specialist to specialist or GP to GP referral is also an example of same specialty referral. We have one-way transfer, let's say transfer to hospice care. It's a one-way transfer. We also have a transfer to a nursing home. Nursing home to nursing home normally is for nurses, for example. But in case of medicine, we can see that old GP is transferring or relocating the patient for any reason to the new GP. Relocation can be caused that we are writing same specialty transfer or referral, right? So normally it's a side type of referral letter. There is no big change, but to see and understand, for example, even if it's a letter of referral from GP to GP, we have to see that you should make sure that we must include each and everything. You should make sure that we must include each and everything in this type of letter of transfer from GP to GP. From old to new GP, we are writing this letter, and it would be to include each and everything, right? Over here. Then we have education letter. In letter of education, if we are writing this letter of education from general practitioner to community regarding the outbreak of new medicine and so on, this is a letter of referral when we are writing to the parents or to the community. So this is your letter of education. So we have discussed some types of letters